Madam Chair, and thank you, Ms. Bennett, for being here. In the previous exchange, my name was brought up in a discussion over NARAL Pro-Choice Connecticut's relationship to this legislation. And so I just wanted to say I'm a proud former executive director of NARAL Pro-Choice Connecticut. NARAL Pro-Choice Connecticut has three arms. It has a 501c4, which does their legislative and political work. It has a 501c3, which does their education and research, which is where this report that we've been talking about all day came out of. And then it also has a political action committee, which is the entity where they endorse candidates, of which, again, I'm proudly an endorsed candidate from NARAL. The mission of NARAL Pro-Choice Connecticut is to guarantee every woman the right to make personal decisions regarding the full range of reproductive choices, including preventing unintended pregnancy, bearing healthy children, and choosing legal abortion. So they're not a pro-abortion organization. They recognize and support the right of every woman to make that decision if that's the decision she wants to make. NARAL Pro-Choice Connecticut, when I was executive director and still today, is not opposed to crisis pregnancy centers. We do validate some of the amazing work they do in communities. I myself, out of college, worked up in the Willimantic area of Connecticut and know that the Crisis Pregnancy Center up there was a support to women in that community. What NARAL Pro-Choice Connecticut is opposed to and what I'm opposed to is deceptive speech. Because, again, the mission of both NARAL and my own personal mission is to ensure that women have access to medically accurate information to make the best reproductive health care decisions for themselves. Thank you very much.
Can I comment?
Sure.
Well, I don't think that the pregnancy center leaders would say that they feel validated by NARAL. I definitely do not think that. And when I was a client service manager at ABC Women's Center, NARAL Pro-Choice Connecticut protested outside of the center, like Molly Hurtado mentioned, and they had a number of different signs about abortion and everything else. And they were protesting, making a lot of noise, to the point where we actually had to shut down the center for the day because it was so disruptive. That does not seem like validation to me. In fact, I've never, in my experience with even going to the public library during a health fair and meeting people from NARAL who were giving out information about pregnancy centers, there was not any validation in those pamphlets. It was pregnancy centers are fake clinics. Pregnancy centers manipulate women. Pregnancy centers exist to coerce women into having pregnancies. Pregnancy centers target Black women. Pregnancy centers are located in underserved areas to target women of color. So we're missing the validation here. It, to me, feels like harassment and bullying.